We're in the thick of a raging battle against COVID-19 in our long-term care homes.
The situation in senior residences is still critical. Today, we've asked the federal government to send 1,000 soldiers. It will give us more resources to help us with non-medical tasks.
It's an acknowledgement today from the Premier of Ontario, Doug Ford, that he needs the Army's help. He is asking the federal government to send in the military to help in 5 different homes. François Legault, the Premier of Quebec, has asked for 1,000 force members to assist in some of the need in long-term care homes in Quebec. To get some perspective on what the government is doing and how dire the situation is, Laura Tamblin-Watts joins us now. She's the CEO for CanAge, Canada's National Seniors Advocacy Organization. She joins us from Whistler. Hi there, good to see you. Thanks for making time for us.
Hello.
I want to start off by what really struck me today and ask you what it tells you. The fact that 2 provinces, the 2 biggest provinces, had to ask for the military to come in to support the system for long-term care as it currently exists. What does that say to you?
It shows that our long-term care system is broken before COVID came in. We've been trying to raise awareness about how short-staffed, how out of sync the staffing and care is compared to the care needs that we have, not just now, but in the future. We've had all kinds of reports saying this, including the Wetlaufer report. But to have the military called in by Ontario and Quebec, I think makes it extremely pointed. Our long-term care system needs help now.
How is the problem or the issue, from your perspective, compounded by this sort of public-private balance? We all know, depending on the province you're in, that some of them will be run by the provincial government and others have private operators. We've seen evidence, particularly in Quebec, of one home, Heron, that had to be taken over by the province because of what was happening there. How much does that sort of compound what provinces are dealing with?
I think what's important to remember is we need to make sure that there are regulatory requirements and guidelines and standards and capacity and start there. But then we also have to make sure that we're not necessarily talking about a bottom line. When it comes to trying to create a profit, we need to make sure that businesses who are in the providing of care services for older people don't do it at the harm of the care. So we need to make sure that we are very thoughtful in making sure that there are staffing requirements, that there are requirements for things like personal protective equipment, not just in COVID, but generally in long-term care, and that when it comes down to it, the dividends aren't being given back to shareholders. We need to make sure that the dividends are care dividends given back to residents.
What are you hearing about PPE on the front lines in those homes specifically? Because weeks ago, we had a number of people on the show who were saying there just isn't enough, specifically in these homes. Actually, some of them were not even being supplied, they were telling us. The provinces have since said they're going to rectify that for the most part. Have you seen a change?
I've seen that there's still trouble getting PPE into long-term care homes. It's getting better. But what we saw was a choice. We saw a choice to put the personal protective equipment and stockpile it into acute care settings. But organizations like CanAge and many other advocates were saying, we know that our most vulnerable will be in congregate care settings, like long-term care. And in some jurisdictions like Ontario, we heard the chief medical officer say time and time again that it would not be a priority and PPE was not needed. That's shocking. Of course it was needed. We saw what happened in Italy and Spain. We saw what happened in Asia. And now we're in a circumstance where they're having to reallocate the personal protective equipment from the stockpiles and the front lines of acute care. It was mismanagement.
What do you think of the federal government's proposal? There are few details at this point, but last week the Prime Minister said he wanted to engage the provinces on the discussion of wage top-ups for essential workers in long-term care homes. We don't know the exact amount, but it sounds like it would be in the neighborhood of those who earn less than $2,500, and they would be topped up somewhere around $3,000. Again, I want to stress I don't know the specifics in each province, and the deal has yet to be arrived at. What do you think of that?
Well, it's a step in the right direction. I mean, we were surprised to see that when the federal guidelines came out for long-term care, which were, in a sense, just common sense guidelines, that they weren't tethered to an actual package. So we're all still waiting to see what this top up would be. But I think the fundamental piece here that we need to pay attention to is how poorly paid the people who work in long-term care are, such that they would ever need to qualify for that type of a top up. I mean, it's egregious that people who are providing the care to our most vulnerable, who are working at the front lines, get paid less in long-term care or indeed home care than they get paid in hospital. So it's a systems problem. I appreciate that we need to do some things right now, but we need to think about how it is that we pay for the care that we need now and in the future.
And how do you envision that being directed? I'm asking you because what I have noticed from every day we kind of listen to all the provinces, right, in their press conferences, and there is a real difference in the way the system works in each province, but also in the province's response. I'll take, for example, BC early on was making it a rule that workers could only work in one long-term care home, not multiple ones. Alberta last week or the week before said everyone, whether they're asymptomatic or not, should be tested in a home that has an outbreak. Now we see Ontario saying today the same thing can happen. But there is sort of this patchwork effect. Does this sort of long-term view on the system require intervention from the federal government?
We absolutely need to make sure that we have a federal, provincial, territorial organization working lockstep to make sure that we have standard practices. And that's what we had expected to see from the federal government. And frankly, we're disappointed we didn't. You know, praise goes to Dr. Bonnie Henry and the team in British Columbia for making sure that when Lynn Valley outbreak happened, that there were the measures taken, the personal protective equipment was provided by the Regional Health Authority, and that they made sure that they were able to limit visitors in an appropriate way. And it's not a surprise to see that they're ahead in flattening the curve. By contrast, we've seen Quebec and Ontario be flat-footed in its response. And right now is the first day where even these measures are taking place in Ontario. They were announced last week, but the lag is there. For us to be in a position where we have to call in the military when we knew that these aspects were going to need coordinated response from all levels of government a month ago is really a failure.
Okay, I have to leave it there. Thanks very much for your time and insights this evening. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.